The knee is brought into 90 degrees of flexion, and the intramedullary canal of the femur is opened with the 8mm IM drill. The valgus angle is set on the distal femoral cutting guide, and the assembly is placed on the distal femur with the IM rod inserted into the femoral canal. The guide is then pinned into place. The distal femoral resection is then carried out using a sagittal saw blade through the distal-most cutting slot on the block. Once the resection is complete, the femoral sizer is placed on the resected distal femur and fixed with the 2-spike punch. The stylus is then used to measure the AP size of the femur, and the measured size is noted. The 4-in-1 femoral cutting block, matching the measured femoral size, is then impacted onto the distal femur. The resected plane of the anterior cortex is evaluated with the angel wing, and the block is pinned into place. The anterior, posterior, and both chamfer cuts are made using a sagittal saw. If a posterior stabilized femoral implant is being used, as in this case, the femoral notch is then prepared to accept the posterior stabilized implant. The femoral notch prep guide that matches the chosen femoral implant size is placed on the distal femur and pinned into place. The femoral notch is prepared with the femoral notch reamer. The notch chisel is then impacted into the slot to clean up any residual bone. Attention is then turned to the tibia. In this case, extramedullary tibial preparation is being carried out. The extramedullary tibial guide is placed on the lower leg, and the guide is aligned for the proper varus, valgus, and posterior slope positions. The stylus is placed into the cutting slot of the tibial cutting block, and the tibial plateau is referenced to set the appropriate tibial resection depth. Once the cutting depth is determined, the tibial cutting block is pinned into place, and the tibial resection is made through the cutting slot using the sagittal saw. Once the tibial resection is complete, the flexion and extension gaps are evaluated. The spacer blocks are used to ensure equal tensioning of the knee joint in flexion and extension, and equal tensioning of the medial and lateral compartments. A trial step is then carried out. The femoral component trial is impacted into place, followed by insertion of the assembled tibia base plate trial and polyethylene trial of the thickness determined in the spacer block step. The knee is cycled through the range of motion to evaluate the stability of the joint. The peg holes for the femoral implant are then drilled. The tibial bone is then prepared to accept the keel of the tibial implant. The tibial base plate is placed in its appropriate coverage and rotational position and pinned in place. The tibial keel punch is impacted through the tibial base plate trial until fully seated. The keel punch is retained in the base plate trial to simulate a keeled implant if desired. The polyethylene trial is replaced and the knee is brought into full extension. The patella is everted and a caliper is used to evaluate the thickness of the native patella. The patella is then resected with a sagittal saw, and the residual thickness of the patellar bone is measured with the caliper. The patellar drill guide matching the chosen patellar size is clamped onto the patella, and the peg holes are drilled. A patellar trial is placed on the prepared patellar bone, and the function of the patellofemoral articulation is evaluated. The trials are then removed, and the bony surfaces are prepared for cementation of the components. The tibial component is implanted first. Apply cement to the tibial bone and the backside of the tibial component, and impact the component until it is fully seated on the tibia. The femoral component is then implanted. Bone cement is applied to the bony surfaces of the femur and the backside of the femoral component, and the femoral component is impacted into place. Once the femoral component is fully seated, a polyethylene trial is placed into the tibial component, and the knee is brought into full extension to compress the bone cement. The patellar component is then implanted. Apply bone cement to the bony surface of the patella and the backside of the patellar component. Insert the pegs into the prepared peg holes and compress the patella using the cement clamp. Once the bone cement has cured, the tibial polyethylene trial is removed and the final polyethylene implant is placed into the tibial component.